It is Breast Cancer Awareness Month, and this morning we're asking breast surgeon Dr. Elizabeth Arguelles about the challenges and impacts of breast cancer. Good morning. Thanks so much for joining us.
Thank you so much for having me.
So last hour we were talking a little bit about how the pandemic has really affected breast cancer in general, the screening, but we want to kind of touch on the treatment and that people are kind of fearful at this point of going in for that.
Sure. Well, the first step is you definitely need to be diagnosed. So you want to go get your mammogram, get your ultrasound. If you need a biopsy, get it. Realize that it's safe to go and get these procedures done. But then the next thing is that you have to realize it's safe to go to the doctor as well to figure out your treatment plan. A lot of people are actually very worried about going to the hospital to have their surgery done. All these hospitals and surgery centers, we have taken precautions to make sure that the patients are safe. We make sure you're healthy before you go in. We're all wearing masks. The operating rooms themselves are clean and sterile. And a lot of breast cancer surgery is outpatient. So you can go home and recover in the comfort of your own home where you're safe. Okay?
Right. Are there any differences in breast cancer over the past year? I mean, with the pandemic, people have been focusing on really just COVID-19 right now. What is it? How do you treat it? What should I be doing? Should I be avoiding certain things? And they haven't been paying attention to maybe some other areas and other health areas. Has anything changed over the last year, maybe 18 months?
Sure. There's actually a lot more almost aggressive breast cancers that people are presenting with. Yeah, instead of presenting with normal kind of stage 0, stage 1 breast cancers, we've seen a shift to higher stage breast cancers at presentation. And the question is really, is it because they've delayed their screening and say presenting to the doctor when they found something? Or is it really that all the extra stress has taken a toll on all of our immune systems and now we're not sleeping well, we're not eating well, and we're not really taking care of ourselves, which can promote the growth of cancer and any illness in your body if your immune system is not functioning to the top of its ability.
So how can we go about preventing this? What should we be looking for? Obviously, you should be testing yourself at home, but how often should we be going in to get this looked at?
Sure. So you definitely want every month. I always joke with my patients, whether it's you examining your breasts or your husband, your boyfriend, your girlfriend, whatever, somebody's got to be touching them. Make sure you don't have any kind of lumps, discharge, rashes, dimpling, especially lower part of the breast. Big-breasted women, they don't look underneath their breasts. Lift your arms up, look at yourself in the mirror. But also you want to go every single year for a mammogram. So don't skip, especially if you missed last year, get in now, because there may be something that would have been caught last year on a mammogram that you can't feel that now is grown that we'll find this year.
And the same thing applies for men.
Absolutely. 1 in every 1,000 breast cancers is a male breast cancer, so they need to be watching and checking themselves as well. And the thing is, for all patients and all people, really, just be as healthy as you can. You want to eat well, fruits, vegetables. You want to decrease the fats in your diet. During COVID, most people are working from home. Get up, move, exercise. Don't forget about that. Most people are working from home. Stop drinking so much. Average less than 1 drink per day.
I feel attacked.
I didn't say how big the glass was, but try and average less than 1 drink per day. So you can really support healthy immune function.
Now, we normally think about this as, I have time. If you're younger, is there a specific age group, age range that we need to really start be looking at this, or does it really matter?
So as soon as you have breasts, start examining them. If you notice a change, report it. Certainly breast cancer in someone in their 20s is not as common, but it does happen. Those are usually associated with genetic risk. But for a mammogram, you want to go starting annually at age 40 for certain. But if you have a family history, your mom, your sister, somebody like that who's had breast cancer, say in their early 40s, you want to go in your 30s, 10 years younger than that first-degree relative to start your screening.
Last thing I want to ask is, Florida, for those that don't know, especially during the pandemic, was really a hot place for so many people to move to. And when you move, you need to find a new doctor. You need to find, everything new in life, grocery stores, where you're going to go to the movies, things like that. When you're transitioning over into a new state, for those that are moving here to Southwest Florida, is it as simple as doing a quick Google search and looking at reviews? Or what's the best way to approach finding the right doctor for you?
So the American Society of Breast Surgeons does have a list of physicians who are affiliated with them. The American College of Surgeons also has a list of who is fellowship trained or a fellow of the American College of Surgeons, so you know that they're board certified and have specialized training in the different fields. And again, asking around to local physicians. The one thing that's so important for breast is if you are going to move, you want to get all of your imaging from your prior facility, put on a CD so you can bring it with you, because those comparisons are worth more than their weight.
Absolutely. Hey, thank you so much. We really appreciate you coming in and sharing all this information. And there's more information up on your website as well.
Yes, Southwest Florida, so swflbreast.com.
Fabulous. Thank you again
Thank you.
so much. Hey, 7:29 is the time. We're going to be right back here on More in the Morning.